Right. I'm going to pull up my screen here and we will get started. I am really excited to be here with you all today. And hopefully everybody can see things all right and hear me okay. Let's see here. So, oh, my slides aren't showing. Sorry about this. Let's see. Okay. So we'll just kind of roll with this. I'm Melanie Cross, nurse practitioner and functional plant medicine provider. And I was so excited when Leaf 411 reached out to ask me to speak on pain. I've had a different response when asked to speak on pain in the past. Several years ago, I was working with a residency program for new graduate nurse practitioners and physician assistants, and I was asked to speak on pain at our annual conference. And I struggled through that presentation, through prepping that presentation, because after 20 years of working in conventional medicine and 10 years at NP, I didn't like any of the choices because they don't work. And like the decision making that goes into recommending prescriptions or medications or what have you in the conventional model is, especially when it comes to pain, is what's going to cause the least amount of harm? Like, how are these choices? So that's why I titled this the way I did, because you've got options. And I want to hopefully empower you to make the right choices and know about these options for you, because you don't have to accept that Band-Aid that you've been offered. And another reason I'm super excited about this is to share with you the healing power of cannabis, the healing power of plant medicine, and the healing power of functional medicine. So what we're going to kind of talk about is how cannabis can help with pain. And we're going to just briefly talk about that. Talk about some methods that I've seen with my clients firsthand on how it might be effective. And then we're going to spend a little bit of time on knowing talk about some lifestyle and functional medicine approaches to pain, which really help cannabis work a little bit better. We're not going to talk about individualized or dosing, because that's super individualized. So let's first look at this kind of describing what the endocannabinoid system does and how it works. The endocannabinoid system helps maintain balance and homeostasis throughout our entire body. It helps with pain and inflammation and stress, and everything is interconnected. So you see, you can't treat pain as like a separate thing, like how I was trained in conventional medicine. It just doesn't work. Pain is not separate from your nervous system. It's not separate from your immune system. It's not separate from your hormones, your cardiovascular system, your endocannabinoid system, especially. All of it works together, and you have to address each piece of it for all of it to work. And so the other piece of that I kind of want to show you is that your endocannabinoid system and maintaining this homeostasis and balance is throughout your entire body. So I know this picture like cuts off, right there. But these receptors are throughout the whole body. And, knowing this and knowing how everything is interconnected really lends to how cannabis can help, and how you do have options and how you participate in your life experience, especially when it comes to pain. So here are some methods that I have found to be helpful when working with my clients. If we look on that top left there, that's a tincture. That is an oil that goes underneath your tongue. I really like tinctures for pain, for the fact that you can get so specific with your dosing down to the drop. And it can be really helpful. They can last, several hours throughout the day. It takes about maybe like 15 minutes to 60 minutes for it to start working, depending on kind of how you're taking it. And it can be, since it works, and lasts so long, this can be really helpful for nighttime dosing, if you're having pain at nighttime, and then also throughout the whole day. I like a 1-to-1 tincture for a lot, meaning like a THC and CBD, having both components. I use that for with a lot of clients as, again, kind of like that baseline and just kind of some maintenance on helping with pain. I have found that you do need some of the CBD component to help with the inflammation, but you also need some of the THC. I haven't found a lot of success when dealing and just strictly using CBD for pain in my personal experience. This other section, the next section over is patches. I love patches for pain. They, you just kind of like slap one on and then you're good to go. They last for most of the day. They can be, you can be discreet. And in particular, I like patches that have one in particular that I like has THCA in it. So I won't get into the nerdiness of what that actually means, but it has the benefits of the THC, but you don't get the high of it, which can be super helpful. So not the psychoactive effects that can be hindering for some people during the day. If you're going to work or like dizziness and just kind of like throughout the whole day, I have found patches to be really effective for pain. And for most of my patients, I will have them like, I don't usually have them use a patch that big. I'll have them cut them into quarters, because here's the downside on patches. They're expensive. The inhalation is another favorite for pain. It can be, especially for like an acute onset of pain. So like, you tweak your back, or you, have a fall and you hurt your knee or something like that. It can be really helpful. Inhalation onset is like minutes, it's pretty quick. It doesn't last as long, but some people are, if they haven't used cannabis before, maybe that's a little bit more intimidating, but it doesn't have to be. We definitely, I've walked through my clients with that and helping them, because I've worked with a lot of people who haven't used cannabis before in a medical setting. So and another reason I really like inhalation is you can totally customize what you're trying to achieve and what your goals are with what product you choose. Then this last one is topical. I love topicals for like pain that is kind of near the surface is where I found that it works the best, or pain that you can kind of see is how I look at it. See and look. The pain, so like swelling, I think topicals can work really well for swelling. And not necessarily pain specific, but they can be really helpful for skin conditions. On this side of things, I've found that CBD topicals work better than THC. So this is just a little bit of information about pain. Pain is not caused by that direct stimulus. So when you touch a stove, it's not caused by the heat of the stove. Is not necessarily what causes that pain. It's something your nervous system tells you to feel in order for you to recognize and respond to that danger. It's telling you something's going on and it wants you to, take your hand back. And pain is being presented to you. So it's presented to you for a purpose. It's your body is telling you something is going on. And I know this might be kind of a hard thing to believe, but I do believe pain is a gift. And we can choose to ignore it, or we can choose to do something about it. And ignoring it, you're not like toughing it out. You're actually causing more harm in the end. So there are definitely some things you can do for pain in addition to cannabis that I found. So what I found with the functional medicine and the plant medicine, the cannabis piece together is they work so well together. The cannabis kind of gets you over that hump and helps you feel better and start to, help with your symptoms. Well, we're using the functional medicine piece to really dig in and get at the root cause of why you're having the pain or why you're having other things that are going on. So everything, again, is interconnected. And if we can address some of these other pieces, our body doesn't have to work as hard, and the cannabis actually can become more effective, to the point where working with a lot of patients. So we sorry, my screen's going a little wonky. We implement some of these functional medicine pieces, and then eventually they don't have to use cannabis, or they have to use much less. So some of these have to do with stress reduction, deep breathing, getting rid of stuff that's causing your body harm, the inflammation and the toxins. Sleep is huge, and then prioritizing as well, this last list under here. So this, like I said, it just kind of lightens the load for your body. And these are the things that make you unique, and why the one size fits all of that Band-Aid does not seem to work, of the conventional model. So this, I know, kind of a busy screen here, but what I just want to kind of point on is your nervous system. There's two sections to your nervous system. You have your sympathetic nervous system, which is your flight or fight, and you have your parasympathetic nervous system, which is your rest, your digest, and heal. And depending on how you're asking your body to respond is, going to depend on which system that you're going to fall into, because you get to decide. You get to decide what response your body is going to have. Are you going to have a parasympathetic response to situations? So if you're in that parasympathetic situation, this is where your healing is going to take place. This is where decreased pain perception is going to take place. Because remember, it's about your nervous system. Pain is a nervous system thing. Or are you going to be living in that sympathetic nervous system, in that flight or fight? We all, a lot of us are just living in that chronic low grade kind of daily stress all the time. And this living in this chronic stress, our body's responding to that. And so pain it causes a stress response. And ignoring that pain, this is what I was talking to you, if that causes more harm, your body's still going to respond. Just because you're ignoring the pain response doesn't make the pain response go away. And so that can show up in your heart, that can show up in your gut, that can show up in your brain. And so anytime we can get out of that flight or fight and into the healing side of things, our pain response and our pain perception is going to improve, as well as, our overall experience in life. And so you're probably like, yeah, stress reduction. I know how, easier said than done. Can be true, but, it doesn't always have to be. So here's kind of one way that I really like to approach kind of getting out of that chronic like fight or flight and into that rest and digest. So through box breathing, deep breathing, I like to spend just 5 minutes a day of deep breathing, and it really can kind of lower your stress response. And so you're starting from a different place. So box breathing kind of goes like this. It's like, I know, something like my daughter would be like, Mom, that's a square. That's not a box. It doesn't have 4 sides, whatever. But box breathing. So breathing in 4 seconds. So you inhale 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. And then in and out through your nose is much more effective in stimulating what's called the vagus nerve than if you were to breathe through your mouth. So this can, if we're starting our day, I like to do this first thing in the morning, like right when I wake up, before I do anything else, is just spend some time before reacting to anyone else, spend some time, 5 minutes doing some deep breathing. And, if we're like right here for our stress response on a typical day, it doesn't take too much to get up here, and our pain perception is going to be that much more heightened. If we can start our day down here, then it's going to take a lot more to get up to there. And so our pain response is going to be even more, it's going to be improved, and it's not going to, things that maybe we would respond to in a way typically are less impactful on our lives, if that makes sense. All right, so inflammation. Remember, again, everything's interconnected. If we can take things away that our body doesn't have to deal with, then our pain response is going to be that much more, positive on our day, I guess is a way to think of it. And one huge source of inflammation has to do with the food we eat, has to do with processed foods. So I like to think of, doing swaps. Is there something that you can do instead, instead of pasta, not just taking everything away, but what can we add in? What whole foods, something that grows, can we add in? Some sort of fruit or vegetable can we add in instead of some of these things? And another source of problems that our body has to deal with has to do with toxins. So our body has to deal with all these extra toxins and get them out some way. I like to think of toxins as an exhaust pipe on your car. And because, this is the thing, pain is in a detox issue. And if we are lightening the load on our body, asking our body less of what, asking it to do less, then again, our pain is just going to be, our response to pain and our inflammation that's going on in our body is just going to be that much less. So, if you have that exhaust pipe on your car and stuff you're just jamming it full of all these extra toxins and stuff can't get out, you're going to be in trouble. Your car is going to be in trouble and your body's going to be in trouble. So just trying to find swaps to not use these things that are just so damaging to our body. Sleep is a huge piece of what's going on. And for the sake of time, I'll let you read through this, but Deep restorative sleep is when things heal in our body. It's when the anti-inflammatory stuff is getting going around our body and taking care of everything that we had to deal with for the day. The big takeaway from here, I think, is getting rid of those blue lights right before bed. You know, a couple hours before bed, it tricks our body into thinking it's it's daytime. So we're not getting that deep sleep. And then this last one is my favorite. So fresh air, sunlight, movement, fun, joy, laughter. Let's prioritize. Let's add more of this into our life. Again, I've said it a billion times, but everything is interconnected. And adding these things into our lives makes just everything else run better in our body. And these are principles you can apply to anxiety, depression, insomnia, because pain is definitely not isolated. And you don't have to live with pain. And you absolutely have options that don't include that Band-Aid that maybe conventional medicine's having to offer. So I'm challenging you to pick something, you know, that you can start today, something from what we've just discussed. Just make something that's easy, that's fun, that's helpful. Take a baby step in that right direction, because you get to decide your story. And I hope this has empowered you and inspired you to know that you don't have to live with pain. You get to decide how things end up for you and what choices you want to make and how you want to live your life. And so if you want to reach out to me, this is how you can get a hold of me. Crossable Health is the name of my company on Instagram and Facebook. And I think I started off at the beginning too with my email address. So that's what I have for you. Thank you so much for your time.